Olá pessoal, estamos direto aqui da AUA em San Antonio 2024 e eu estou aqui junto com o Dr. Joseph. Dr. Joseph is from Upstate Medical University, and yesterday he presented a paradigm shifting study, the Sunrise One. Joseph, could you briefly tell us for which patients this new modality of treatment is indicated and the results of the arm that you presented yesterday?
Thank you so much for speaking with me, and it's an honor to talk to the Brazilian Society of Urology. So we presented a new type of therapy. It's called TAR-200. It's a device that's a targeted releasing system that's placed in the urinary bladder with a placement catheter. The device is placed in approximately 2 to 3 minutes, and it's removed with a cystoscope, just as you would remove ureteral stent with a cystoscope. The results were surprising yesterday. The data was presented earlier, about a year ago, and then the results were in the 74-75% range. And as we accrued more patients, the overall complete response rate was almost 83% in this population.
Which is pretty higher than the other options that you have so far.
It's much higher than what we've seen in the past. If you think about what's approved right now, checkpoint inhibitors anywhere from 15 to 19% response rate at 12 years, and their complete response rate was around 40 something percent. So it's a massive improvement. And this response was seen pretty quickly at the first disease assessment. So these patients weren't getting re-induced. They had standard protocol treatment, and you were seeing the response pretty quickly. Rarely you see the response go up as you accrue more patients. So that was the surprising thing about yesterday, is as we accrued more patients. So when we presented 30 patients a year ago, it was the complete response rate wasn't as high as when we presented 58 patients yesterday. So, to answer your question, I'm sorry. To answer your question, these are patients that are unresponsive to BCG. So these patients have received a lot of BCG and no longer are responding to BCG. They have high risk, non-muscle invasive bladder cancer. And so this is a patient population that classically doesn't have a lot of good options.
Thank you, Joseph. I'm sure that your study is really a paradigm shifting. Thank you very much and have a nice AUA. Thank you.